Hi, Lindsay.
Good afternoon.
Good to see you. Hello, everybody. Is that John Horn? Hey, John Horn. Long time no see, Javier.
I just wanted to test my mic out. Tanya or Karen, do you guys hear me?
Yeah.
Loud and clear.
It's my fourth headset I've used on this laptop, so I just wanted to make sure it works. Hi, Karen.
Good to see you.
You as well.
Alberto, how you doing?
I'm good. Thank you for asking. Nice to see you all.
Yeah. Let's see, Wayne. Hello, Wayne. Hello, Miss Madam Vice Chair.
Good morning, everybody, or good afternoon.
I know. I do that all the time, Michelle. I'm like, wait, what time is it?
Day's been a blur.
Is that Demarius? Hello, Demarius.
Hello. Good morning, everybody. This is Carol from Faith in Action.
Hey, Carol. Are you extending our morning for us? That's good. I like it when that's kind of like, Monday was a holiday for some of us, and usually it just like goes so quickly. It was the first time it was like, wow, this day's lasting long. I love it. I was relishing in it.
Good afternoon, everybody.
Hello, Brian. Welcome.
Thank you.
I know I can't see everybody's pictures or faces.
People in attendance. I love that we have such a full house. Welcome, everybody. It's good to have you on today for our Continuum of Care meeting. Excuse me.
I like this new sound of your voice, Tanya. We want you to sing us a song today during the meeting.
Yeah, I can't wait till I get my regular voice back. But you're right. I think my husband likes it. It's a very chill version of Tanya.
So I've dropped the sign-in sheet just so we can start getting roll call for our voting members and to establish quorum. And so far we have 7. So if you haven't filled it out, I just dropped it in the chat for y'all.
Let me get that filled out.
Mariela, I know Oscar Ramirez is with the VA and they have a very protected site against scammers. Oscar, you got to tell them we're not trying to scam you, but I wonder if there's a way that
I've been trying.
If there's a way that maybe we can check in on our side.
I can definitely do that. Oscar, what's the name of your agency?
VA Loma Linda Medical Center.
Got it.
Thank you.
No problem.
Everybody knows the famous Oscar. Hey, Ayoko, how are you doing? Good to see you.
Oh, great. Thank you. How are you all? Good to see you all.
Good.
That song, Staying Alive, Staying Alive, what came to mind.
So should we get started? It's 2:04.
Sure thing. I'm ready when you are, Madam Chair.
Okay, why don't we go ahead and pull up the slides? Look, you do have it pulled up. I got to click on it. All right.
No worries.
Good afternoon, everybody. Welcome to our special Continuum of Care meeting and a special HAP 5 planning session. We have all kinds of exciting things planned for you today. Just wanted to give a shout out to all of the Continuum of Care HWS staff who did a lot of planning and research and preparation for especially the HAP meeting today to make sure that we can keep the strategies and goals on target and the funds flowing into our regions. So we'll have exciting stuff for you. The Continuum of Care meeting might seem like it's a little bit shorter today, and that is because we want to get through the Continuum of Care to get right to the meat of what is important today, which is focusing on HAP and making sure that you all have a loud voice and that we have an open and transparent process for a very significant funding stream for our Continuum of Care. So with that, we're going to jump right into the agenda items. So we'll start with new voting members. It looks like we have a new voting member, Walden Family Services and Operation Grace 2. Do we have any representatives here from either Walden Family Services or Operation Grace with us today? Well, even though they're not here today, we want to welcome them. It's truly a goal of ours to make sure that we continue to be very diverse. The table is big, so we want to continue to invite more people and agencies to become a part of the Continuum of Care. So let's go ahead and move on to the next agenda item, Marielle. Now we're going to move on to agenda item number 2, consent items. At this time, we're going to consider approval of the November 15th, 2023 Continuum of Care meeting minutes. Do I have a motion to approve?
I can make a motion, Ms. Karen. Sonia Lamas.
Thank you, Sonia. Do I have a second?
I'll second.
Thank you, Carol. Do we have any objections or abstentions? Hearing none, the item passes. I'm assuming we reached quorum. I'm sorry to charge ahead of you, Marielle. Are we at quorum?
No, not at all. Yes, we are.
Okay, thank you. Sorry about that, you guys. Okay, thank you all so much. Let's go ahead and move on to the next agenda item. At this time, members of the Continuum of Care will hear public comments. If anybody has any public comments, you may speak on items that are not on the agenda. You have up to 3 minutes. Marielle, have we received any written comments from the public?
Nope, none through our email.
Okay. Do we have anybody here that would like to make a public comment? Please feel free. Raise your hand. It looks like our Vice Chair, Michelle Davis.
I just want to announce the City of Riverside's Housing and Homeless Committee that meets next Monday at 3:30 in our council chambers. We'll be considering a local housing trust fund, and also we'll be reviewing the HAP 5 funding recommendations for the city's grant fund. Or to have that discussion, and welcome everybody here to attend that meeting. If you go to riversideca.gov, go to government meetings in the top right corner, and you can pull the agenda, provide any written comments, or attend the meeting and provide comments in person.
You guys are such rock stars in terms of all that you're doing for affordable housing development, Michelle. Just a big kudos to you, your team, and your city council. It's amazing. You guys are wonderful.
Thank you.
You're welcome. Anybody else? Don't be shy. Does anybody else have any public comments at this time? Okay, hearing none, let's move on to the next agenda item. Standing agenda items. So we'll go to 4.1, coordinated entry lead update. Lucy Bustos. Lucy, are you here?
Yes, can you hear me?
Yes, so you have the floor. We'd love to hear your update.
Okay, so we're here to give the CES lead update. Our next slide. So it's just a little breakdown of our CES Home Connect calls. So about 2,641 calls for the month of January. A couple highlights: 998 on the queue. We have about 210 open home connections with 117 sent home connections for the month. Next slide. A couple areas of improvement that the coordinated entry system has identified includes the community queue cleanup. So we as a system will remove clients from the queue once a Home Connect referral has been sent out. And if the home connection for the respective site is not completed, the consumer will be added back onto the queue at original placement. Agencies will still need to exit consumers from CES and enroll in their respective programs once housed. CES is also continuing to schedule in-person and virtual trainings for agencies and new members. And lastly, we are trying to streamline the process for PBV projects by collaborating with Housing Authority. Once the home connection has been sent out, by sending the Housing Authority packet and questionnaire in order to ensure the application process be completed in a more timely manner. Next slide. The majority of referrals for projects including Oasis, Vista de la Sierra, and Entrada have been sent out. Rancho Las Bolsas and Vista Sunrise are set to open in April. We have begun to send out those referrals, and Aspire is set to open in July, August now. And we are looking for grant clarification before sending out referrals for those and screening. And lastly, if there's any CES partners that would like to present, we ask that you contact us at the Home Connect email that's presented on screen, and we can get you either in the CES partnership meeting, or if you would like to present, we can get you going on that as well. And that is it for me.
Thank you very much. Also, I don't know if I missed it, but the Vista Dorada permanent supportive housing project grand opening is happening on Monday in the city of Corona. Did I do this? If it was on there? Anyways, we're pretty excited about that. Huge partnership with behavioral health and HWS. Tanya?
I just wanted to add, Luce, I love that you guys are looking at working with the Housing Authority and working to identify how to best coordinate vacancies that come through the project-based voucher program. I wanted to highlight and make sure that you were aware that last week we launched our Hope to Home initiative, and this is a countywide continuum of care led initiative that brings together all of the different nonprofit provider agencies and the housing navigators from their respective teams to basically work on pulling together a platform. I know you guys have heard us talk about it. We refer to it as PadMission, but it's a web-based platform where we will be able to track and share unit vacancies from across our entire county. And so one of the things that we've talked about is including vacancies from across our different affordable housing projects, so that as we partner with developers and they set aside so many units from each of the projects for individuals or families who are experiencing homelessness, that those units are also tracked in PadMission. So if you're thinking of PadMission, it's like a Zillow-like type of platform. Our plan is to showcase this platform during one of our future COC meetings. So we'll give you a preview very, very soon. We're close to making that live. But right, the idea is that as these projects go live, that those vacancies are tracked in that platform. All of your staff members, all of your agencies have access to this link and can readily go on and look at those units as they become available. So I just want to share that with you and just really thank all of you for inspiring that, because again, we can't take credit for these good ideas. These ideas come out of conversations that we have with your teams when you guys raise questions about, how do we do a better job at facilitating faster connections to housing. So hope that made sense. We're really excited about that. We appreciate you all.
Good job, Tanya.
Thank you, Tanya.
Add to that we are tentatively scheduling our service provider training for the Hope to Home initiative on March 5th.
Good deal. Thank you, Rashawn. I think Greg, you had a comment or a question?
Yeah, I just wanted to add on projects. Actually, tomorrow is the grand opening of the Monarch apartment complex in Palm Springs. So anybody in the Valley, you're more than welcome to attend. It's at noon at the Monarch thing. So very excited about this project.
Cool. Great to share. Thank you, Greg.
Yeah.
Anybody else? Okay, well, thank you for all the good discussion and to our team members from Behavioral Health for coordinated entry. Let's go ahead and move on to the next agenda item. YHDP update. Do we have our Miss Monique Guerra in the house?
Hello, hello, everyone. I'm on. Alrighty. So hello, everyone. Quick update on YHGP. Just thank you all so much thus far for sticking it out with us. We know that there's a lot of working group meetings and a lot of meetings that come from this YHGP grant, but all of it is just tailored to wherever you fit in. So please, if you're trying to get involved, let us know, either myself, Mar, or Gershom, and we can get you included. As of now, we're still meeting on a weekly basis every Wednesday for our core team meetings. So if you are able to attend at least once a week, please let us know if you have not been included in those Wednesday meetings. But we are still working on the CCP, hoping to get a draft out by February 29th at the in-person Youth Advisory Committee Youth Action Board meeting this month. That meeting is also doubling up on the YHDP in-person meeting. So if you have time and are able to attend for the full day, please plan on attending for the full day in person on February 29th for the Yak Yab meeting / YHDP in-person continuation. We're just going to keep going through that draft, and our hope is that we'll be able to present a full draft in March, maybe to the COC is our hope, so that everyone can see kind of the plan that we're coming up with as a community to address youth homelessness and what kind of eligible projects are being proposed that will hopefully lead into the RFPs down this year in April-May timeframe. So again, please plan on attending the in-person Youth Advisory Committee meeting this month. It will be at the Bridge Wellness Center in Moreno Valley. If you all have not checked out the center yet, this will be a good opportunity for us to all go check out the center. It's with Kanisha Jones and Amir King in Moreno Valley. So really excited to see their new center open up and just really learn about all the great things that they're offering youth and hold our meeting there in that space. So if anyone has any other questions about YHDP, let me know. I will put my info in the chat. And again, thank you all for participating and sticking it out with us. I know it's a lot of months, lots of meetings, but again, our hope is that we'll have a good, efficient youth system so that, you know, folks can access services. And again, so that service providers are aware of all of the amazing resources across the county. Thank you, folks.
Good job, Monique. Are you feeling good about our progress?
Yes, full transparency, we might ask for an extension, not because we're behind, but because we're being very intentional and strategic about the projects that are being proposed and also the unique needs across our county. We know that accessibility, our geographic area is very large, and so we want to take a lot of the barriers, right, to accessing services into account, as well as location and where programming is going to be built and or created. So I think we're doing really well, and I think it's brought everybody together. And in that, we're also educating folks along the way, right? So it's brought in a lot of new information for folks about the COC itself, which has been really exciting, and also more along, right, what youth in all of the spaces that we've been meeting in have been participating in. So their lived experience in every stage and space has been unique and really awesome. So I think we're doing well. Good progress.
Awesome. Thank you so much. Keep up the good work, you and all the people that you're working with. Such an important initiative. Okay, let's move on to the next agenda item. Informational items. So you can see that there is a Youth Advisory Committee report in the Google Docs. And then also something that myself and Michelle always love to do with every opportunity that we get, and that is to sign letters of support to support organizations in our continuum of care to bring more resources to the region. So we were very blessed to support Lighthouse Social Services, Healthcare in Action, and US Vets. Those letters are available to you. Oh, it looks like. Brandy, did you have a question before I move on?
You know, Karen Younglow asked me to attend this meeting in order to express her gratitude for the signing of the letter. Our grant will be completed on Friday and it will be submitted. So she just wanted me to let you guys know how grateful she was for that.
Oh, that was easy peasy. We were like,
yeah, thank you guys.
Yeah, and you guys are rock stars. So that's
thanks.
really fun. Keep up the good work.
Yeah, we're all doing the work out there. Thank you so much.
Yeah, absolutely. Okay, so then the next agenda item, 5.3, are the annual performance reports, which are also available in the Google Docs. You can see the 3 different projects there: Riverside Planning, Jewish Family Services, and then LSS PH for disabled women and children. So next agenda item. Wow, that's the fastest we've ever gone through a continuum of care meeting. That is a record. Can't even believe it. Okay, so at this time, we are very happy to entertain suggestions for agenda items for the next meeting. Do I hear any suggestions? Anybody?
Hi, this is Carol Olbaugh from Faith in Action. Can you hear me okay?
Yes. Hi, Carol.
Hey, well, this really isn't an agenda item, but I forgot to do it with the announcement, so I thought this is the best place as possible. For any agency out there that is available on Saturday, this coming Saturday, we are having a sellout event at our warehouse in Banning, and any nonprofit that comes with a truck and people to haul some items. We do have some large housing items and bedding and dishes and stuff like that is available for anyone who comes out on Saturday from 10 until actually 9 until 1 o'clock. It's a complete giveaway. And if anybody's interested, you can come to 947 Ramsey Street in Banning. And I'll put all this in the chat for any of you that are looking for items and maybe you can come by on Saturday. That'll be the last time we do this. So thank you for letting me make that announcement.
Of course, keep up the good work, Carol. We're so proud of you and the work that you're doing in that region with all of your partners.
Thank you.
Okay, next agenda item. Okay, you guys, does anybody have any announcements? Anything exciting? Come on, Tanya, what exciting announcement do you have for us?
We sent out an email a few minutes ago, and I apologize if I sound like a broken record, but I wanted to make sure that we encouraged you to participate in the 2nd District Homeless Symposium that is coming up and will be held next week, February 29th from 9 to 11. Again, this is for 2nd District. Supervisor Spiegel sits on our Continuum Care Board of Governance, and as many of you know, has been a huge champion for this work, as have all of our County Board of Supervisors have been. This symposium will feature presentation by several county departments, I should say panel discussion by several county departments. County Behavioral Health will be present in addition to Adult Services. Greg Rodriguez, our very own Deputy Director of our Governance Affairs at HWS, will also be on the panel. We also are including parks, and then we have several cities in that district that are going to be speaking and showcasing their local efforts to address homelessness in their jurisdiction. So we really, really want to encourage your participation. We, of course, are coming back from having done the 4th District Homeless Symposium about 2 weeks ago now, and it was such a great event in large part because many of you attended and were able to help us really speak to the needs of clients. You spoke to the things that are working and areas that could be improved, and really that's what these spaces are all about. So we hope that you will attend. The flyer did go out by email, and we look forward to seeing you there. Thank you.
Thank you. Sonia?
Yes, thank you, Tanya. I did get that email. I actually just printed it, so thank you. I was looking forward to that. I wanted to announce that on the 27th of this month, February, we host a one-time-a-month job fair through the workforce development in the Greater San Jacinto Chamber. We put on like a little workshop through the Llamas Housing. So it's been something that's been happening for the last year now. And every month we've had an increase of anywhere from 18 to 25 people. So I believe last month we were like at 137. So I want to encourage all of the nonprofits that are, that have resources available to come out and participate. It's free. We're there from 9 to 12. So you guys are all welcome. I just wanted to point it out and invite you guys to come out and participate. So thank you.
Thank you.
Mhm.
Any other announcements? Don't be shy. Monique?
I'm sorry, you all are going to hear from me again, but tomorrow we also have a multidisciplinary approach to ending homelessness webinar. So please, if you are able to attend that, we're working alongside our YHDP HUD TA providers, and they will be doing various topics from here until April, May timeframe on various items for our community around youth homelessness. And so that training for tomorrow will be 2 hours, but there will be a break in between. So if you have time, please attend that. The invite should have gone out. If you need it, please let us know so that we can send that to you. And it will be facilitated by Isaiah, who's our HUD TA, who has been working closely with our YAB. So very excited to present Isaiah to the community, and a great topic. So thank you all.
Okay, anybody else have any announcements? Okay, next agenda item. Okay, we're not done. So we're gonna transition from our Continuum of Care meeting into our exciting HHAP program round 5. So at this time, who do I have the pleasure of turning this over to? Tanya, are you kicking us off?
To me, Karen.
Oh, I'm sorry, Miss Emma.
That's okay.
To our amazing Emma. Take it away, Emma.
Thank you so much. Good afternoon, everyone. And I just wanted to take this opportunity again to thank you for attending our COC meeting and also for staying and attending our regionally coordinated homeless action plan. It's a mouthful. Homeless Housing Assistance and Prevention Program Round 5 feedback session. As mentioned earlier, my name is Emma Perez Singh, and I'm the COC manager for the Department of Housing and Workforce Solutions. I, along with Rashana Walker, who is the COC supervisor, will be taking you through the remainder of the meeting. Next slide, please.
Emma, before, do I have a comment? Do we have a congratulations in order for Rashana? I think she got promoted, didn't she?
Yeah, several months ago, actually. I'm not sure if, I think we announced it a few meetings ago.
Okay, I just wanted to make sure we congratulated her. She's so awesome.
Tanya did you want to jump in, Tanya?
I was trying to look for the clap button, but I'm happy to jump in.
Oh, I thought I saw you raise your hand.
Rashana has been with our team since we absorbed the Continuum of Care back in 2020. And I often share with folks that we stole her from US Vet. And if anyone is on the line from US Vets, you know that I say that with lots of love. US Vets is a critical partner in this work. And I had the pleasure of, when I worked at the Housing Authority, being trained by Rashana on rapid rehousing and specifically the SSVF Supportive Services for Veteran Families program. And so we're definitely overdue in promoting Rashana. She accepted the promotion about 2-3 months ago. And so now she has stepped into the role of supervising program specialist and is overseeing all of our homeless programs. So HAP, CASH, all the different acronyms we use, they all fall under her preview. And we are so fortunate to have, again, someone that really comes from that direct service provider lens. She sees things in the same light way that you do. And she has the educational background, has a master's in social work. And I always describe her as a very fair and balanced leader. So whenever I get all diva and passionate, she has a way of reeling me in and saying, okay, Tanya, but what are the facts and what is the data telling us? And that's a huge part of the reason why she is where she is today. So congratulations, Rashana.
Thank you. And I apologize, Miss Emma. I didn't mean to derail you off of your slide. Thank you.
Blessed are the flexible.
Yay!
Okay, and so before us, we have the meeting agenda. We're going to take just a few moments to do introduction and general overview of the HHAP application and requirements, give you a little bit of background of what we've been doing with the HHAP funding, and we're going to be going over system performance measures and our breakout group instructions. I will hand it over to Roshana once we go through that, and she will take us through the remainder of our time together. Next slide, please. All right, so I'd like to begin with noting that about a year ago, we formally adopted the county's homeless action plan, which included 5 action areas along with 36 strategies, which has positioned us as a county, as a system, as a continuum of care very well for HHAP funds, and has helped our community to align to the state system performance measures that are tied to HHAP, which again, Roshana will go over more in depth as we progress through the slides. To date, the COC has made major investments using prior rounds of HHAP funding to provide and develop a network for rapid rehousing, and specifically targeting populations of interests. For example, seniors. We funded a program through the Department of Public Social Services Adult Protective Services, which provides rapid rehousing services along with other supportive services to homeless seniors across the county. Also, with the help of our homeless youth coordinator, whom you heard from earlier, Monique Guerra, have brought on 2 additional new TAY rapid rehousing providers. And so a lot of work has been done in addition to other investments across the county. And, you know, a huge thank you to our Board of Governance and the Continuum of Care membership as a whole for your support, guidance, and direction with those efforts. For HHAP 5, in order to be eligible as a region, we must apply as part of a region. So that includes Riverside County, COC, and the city of Riverside. And the purpose of this meeting, you can go ahead and advance to the next slide, Mar. The purpose of this meeting is to obtain input from community members and stakeholders so that we can establish and target effective strategies to reduce homelessness in our county. And you can see there the different allocations that have been set aside for the COC, the county, and the city of Riverside on the bottom left hand of this slide. Next slide, please. Before you are eligible uses that are prescribed within the HHAP 5 NOFA, which include permanent housing solutions, interim housing solutions, and an umbrella category of services for people experiencing unsheltered homelessness, system improvement and supports. And there are other eligible uses which are enumerated within the NOFA application. We do want to note, you can see there's a special note that under the HHAP 5 NOFA, a region is required to demonstrate that the region has dedicated sufficient funding for permanent housing if we are wanting to use these funds for interim housing solutions. However, that rule does not apply to our youth set aside. Next slide, please. And we have come to the portion of our presentation where Roshana will take us through the system performance measures.
Good afternoon, everyone. And Karen and Tanya, thank you for your kind words. It had me blushing, a little shy. But I do want to go into the systems performance measures that the state has outlined in our HAP 5, actually in all of our HAP applications. However, as Emma stated earlier, our county is ahead of the game because we have an adopted homeless action plan that speaks towards each of our systems performance measures for HAP 5. So kudos to the county, to all of you all who assisted with the development of our homeless action plan. We are probably ahead of the game than most other continuum of cares. So just the systems performance measures, the number of people accessing services who are experiencing homelessness, the number of people experiencing unsheltered homelessness, the number of people accessing services who are experiencing homelessness for the first time, then the number of people exiting homelessness into permanent housing, which is one of a big performance measure that we should be aiming towards achieving all the time in our line of work, right? Systems performance measure 4 is the average length of time that people experience homelessness while accessing services. So the length of time that they are still on the streets or still homeless while receiving services. 5 is the percentage of people who return to homelessness within 6 months of exiting homelessness, the homeless response system into permanent housing. And then the last measure is the number of people with successful placement from street outreach. So directly from street outreach into permanent housing. Next slide. So at this time, we're going to have a breakout group activity. So in a few minutes, everyone will be assigned to a different systems performance measure work group. So there are facilitators in each, there will be facilitators in each group. And those facilitators will work with all of you on a chosen systems performance measure for you to, and those were pre-identified strategies from our homelessness action plan, as we mentioned. So the groups would work to identify a lead entity and a collaborative entity to carry out each of the strategies that we pre-identified for each of our systems performance measures. So we're not reinventing a wheel. We already worked so hard on this, our homeless action plan, that we are ahead of the game. We already have strategies for each of our systems performance measure. But additionally, the groups will review if there are any current projects that are underway and brainstorm on any new ideas that can be that feel that we can be implemented for each of your specific systems performance measure. So you're going to look at the pre-identified strategies based off of our homeless action plan. And then if you have any new strategy that you want to provide us feedback for, give us that feedback. Each group will have 30 minutes for this exercise, and then everyone will be brought back into this main group, and each group will report out. The facilitators will report out. They also have someone taking notes. So in the event you guys do not get through each of the strategies for your systems performance measures, we will send out a draft copy of it. And if it's something that you would like to share, then please feel free to email it back to us with any of your feedback or ideas. Does anyone have any questions regarding the group activity? No? Well, you will be assigned, at this time, you will be assigned to a specific systems performance measure, and we will be back in 30 minutes. And that will be 3:08.
Welcome back, everybody.
Hi, Youngmi.
Hi, how are you?
Good to see you.
Good to see you too as well. And you guys.
Hi, Michelle. I ran into oh my gosh, Brittany.
Oh. She's like, I got in the elevator with her going up, and she's like, did you see Emma? And I'm like, no, where is she? She's like, oh, she went to go get lunch. There was a big group of us sitting on the first floor chatting it up.
Oh, yeah.
Our group was having so much fun. We were almost
Right,
done.
you guys pulled us back in.
You pulled us.
We're like, we could provide more ideas.
We were having such good conversation too.
Yes. Yes, it was like really rich dialogue. I love it.
No warning at all. Just click.
I know. It was like,
Oh.
you know what? It reminded me of Beam Me Up, Scotty. And like next thing you knew, you're like in another realm.
Well, they did have the warnings at the top. I don't know if you saw it, but it told you was going to be linked back to the main room in like 10 seconds.
No, our eyes were focused on the person that was
I
talking.
know.
Yes.
I'm so sorry.
We need something that flashes.
I know. Great conversation, everyone. I just want to truly thank each and every one of you guys because it seemed like we had some wonderful conversation, ideas. I'm excited to hear all of the new ideas or see all of the new ideas that each one of your groups brought out for this session. And just to let you guys know, so what happens next, we're going to take all of your feedback. We're going to present a draft of our performance measures and our actions. We'll send it out to all of you. If you have any additional ideas, actions, please feel free to reach back out to us, and we will go from there. But what happens is we're going to take this back and include this in our application. And then we will, once the application is due March 27th, but there is a 6 months, a 6 month application window where we go back and forth with the state. And then they announce their awards. But once they announce their awards, then we will present at our BOG meetings of or recommend at our BOG, our next BOG, not next BOG meeting, another BOG down the line will recommend our funding allocations based off of the need, based off of what you guys just discussed in your breakout groups. Any questions? Any last minute thoughts about our sessions? Yes, Karen.
Yeah, for the leaders, if we can help you, we were like moving fast because we had 9 strategies to cover. So if you find that some of the notes, you know, we need to like finish constructing the sentences. If your leads can help you with that, let us know because we were moving fast to try to capture everybody's ideas.
Yes, thank you, Karen.
I also wanted to mention, and I apologize, I neglected to do this earlier before we went into our breakout groups, but I just wanted everyone to be aware that part of what we're going to be doing as well in constructing our plan is looking at any potential disparities. And so we want to make sure that there is equity across the board, racial, gender, et cetera. And so when we identify inequities, our plan will include actions to address those inequities. So I just wanted to make sure that I stated that so that everyone is aware.
Also, too, I got super excited. I forgot we need to report out from your different within your different groups. So we're going to have each of our facilitators report on your system's performance measures. And we can start with the performance measure 1A. I believe that was Karen.
Yes. Mar, are you able to pull it up? Because I had both Tanya and what is our new encampment response person's name?
Damaris.
Yes.
I could pull it up, Karen.
Yes, if you can pull it up, that would be great. And we'll just it'll be a fast moving train.
Can you all see it?
Yeah.
Perfect.
Okay, so let's see here. All right, so this particular, if you go back to the top, you can see what we're focusing on is it's people that are accessing services. And so the strategy, strengthen coordinated access. The natural lead agency is behavioral health coordinated entry, supporting organizations, the CFC, HMIS lead. And then as far as new ideas, we talked about when there was access points at the community colleges. Chris gave some really good examples of how Path of Life is working with the community colleges, and they're actually tapped in. She talked about like Riverside and Norco colleges that are accessing HMIS, as I understand it, and coordinating in with the system. They made a suggestion for broadening that for the school districts. And then also we talked about it would be important to increase funding to make sure that there's enough licenses. As of right now, I think we have a shortage. And if we want to be able to throw the net out further to have enough adequate funding to have more HMIS licenses. And again, that's all about strengthening coordinated access. So let's go to the next one. Okay, so this particular strategy, enhancing city and regional government capacity and system infrastructure, we really felt that HWS would be the great lead agency, and then CFC supporting, and collaborating agencies could be WRCOG, League of California Cities, the Nonprofit Roundtable, DHCS, and then local city council members. As far as new ideas, we talked about we wanted to continue to support incentivizing RFPs to promote capacity building between cities and nonprofits, more sharing of information. So not reinventing the wheel, but making information available is a good way to build capacity. Chambers of Commerce are great resources to help share information and build capacity. So those were some of the ideas. We'll go on to the next strategy. I hope I'm going at a good pace, you guys.
We have lots of time still, so you're good.
Okay, so strategy 8, refine communications around efforts around homelessness in Riverside County. Everybody unanimously agreed, since HWS was really formed by the Board of Supervisors to coordinate all of the county agencies and the continuum of care, that they'd be a good lead agency. Collaborating agencies, of course, would be the Policy Advocacy Committee. We have a working group that focuses on communication and coordination and advocacy. And then, of course, they talked about city communication teams. Public health is a good avenue for getting important information out into the community. We don't want to underutilize. We want to expand using social media communication channels, county and city agency website information. And we all felt that when you're looking at some of the initiatives that are already happening, which you can see like press releases, symposiums, videos, when you're thinking about those messages, we need to continue to do more client testimonials. You can have technical staff, you can have elected officials, but the single most powerful message in terms of communications in this space is people's lives who have been transformed. And then also Chris had the good idea of a coordinated calendar, shared information, and the example that was used was 100 Women Who Care, where a lot of different people come together and share information and benefit through shared information and resources and getting it back out to the community. Next strategy. Okay, increase regional capacity of homeless street outreach. Again, we thought of HWS and Tanya and your team, the amazing work you guys have done to really build an infrastructure where you flip the switch with all of the different outreach teams that are funded through the Continuum of Care. But even those that aren't, like you think of the cities of Corona, Norco, they fund their own, but they still work through that big regional approach where if there is some kind of an emergency or disaster, it's a way to have a regional coordinated effort. Some of the examples of the teams are Path of Life, CityNet, Behavioral Health, Step Up, Healthcare in Action. Law enforcement has multiple, Hope Team, PSET, NorcoSet, so on and so forth. Some other ideas, we need to finish this out, but we talked about as far as other partners that could be involved would be the colleges and the school districts. Really felt that there should be more of an emphasis. This discussion was about funding through CalAIM. And so where we went with that was, we know HWS is already on a path, I believe, of trying to get an organization in place that's going to assist to provide technical assistance and training for nonprofits to be able to effectively access CalAIM resources, which supports this whole initiative. I hope that makes sense to everybody. The next strategy 14, improving access for people who are experiencing homelessness. Again, We really felt HWS is a good lead, of course, with the support from the whole continuum of care, the BOG outreach teams. And then some of the other ideas that we mentioned were additional housing resources that can prioritize homeless individuals, strengthening partnerships with DMV, Social Security, county offices, street telehealth, this was a big discussion, more enhanced care management approach, more street medicine, and even involving vocational schools. And then we got cut off and beamed back to here before we got to finish the last strategy.
Great information, Karen. You guys got through a lot of your strategies. Great job, Team 1A. So the next team was Systems Performance Measure 1B. Is that you, Leonard?
Yes. Gordon, do you want to share that, or would you like me to?
I have it open, so I.
Oh,
will
you have it open?
start.
Oh, there we
I'm
go.
ready. I was born ready.
Thank you. All right, Tanya. All right. We have the technology. So we had a great group. We got through 5 of our 7 strategies. So the first one, of course, is increasing the regional capacity of the homeless street outreach. We just really acknowledge what's already happening. So we know the COC, HWS, the lead agency, and then we have a number of COC funded street outreach teams all over the county, right? And then also there's some non-COC funded street outreach who provide services out there. And so they collaborate also. So I think staff can, identify those, list them out. And then we have, of course, a great partner in RUHS, different mobile teams, crisis units, all those things. So we didn't really discuss any new, maybe we did, but we didn't capture it. The conversation was so great and rich. We didn't capture all the new ideas, but we know that what's going on now is kind of striking a keynote. And if we can build on that, I think we can begin to see really some evidence-based stuff come out of the more recent growth in the last 3 or 4 years. And I think that's going to be important. So let's go to number 13. As you type, support the health of people experiencing unsheltered homelessness through cross-departmental, cross-sector supports. I know I'm really excited about some of the recent developments in regard to even the elderly outreach that's going on now, and cross-departmental stuff with the county. And then, of course, we have all of our cities and the other nonprofits who really, it seems like in Riverside County, we're coming together in a great way, really more collaborative. There's some verbiage we use in humanitarian circles, like everybody wants to coordinate, but no one wants to be coordinated, right? Someone has to take the lead. And I think it's important that all of us kind of find our space and do our best. And I think that's what we're starting to see happening. So if you look at all the collaborating agencies, I think we can be proud of that. And just working together, it doesn't necessarily mean one group is going to get the accolades, but everybody is playing their part. And so we didn't really elaborate on a lot of new ideas under that one either, but just acknowledging what's happening. Number 14, improve access for people experiencing homelessness. Karen and those guys did this one, so I don't know if we need to discuss this too, but no, just kidding. So we've got HWS, COC, CES. We talked a little bit about increasing access points, similar to what was mentioned before. And now that we're, reaching deeper into, as you guys are aware, with college students, the TAG population, some of those folks are not accessing the homeless services system in the same way that traditionally the people that we've served has. So they're not coming to our shelters, not going to necessarily the places that normally some of the folk in the past have accessed homeless services. So having some of those places more readily available for these populations, these special populations, is important. Let's see, 15. Countywide encampment management protocols. again, the last 3 or 4 years have seen, of course, a national emphasis, a state emphasis, and now local county emphasis on protocols. And I think we've seen some movement in that area where we have the county, we've got some of the local cities, we've got, of course, the encampment protocols that COC is pushing out and the county's pushing out. And I think if we get everybody embracing those, then we will have the coordination, countywide, statewide, replicating the Santa Ana riverbed model. If that's working, that's being effective, that can be utilized not only in the Santa Ana riverbed corridor, but maybe I think Tanya mentioned the San Jacinto river bottom out there. So if it works there and it's a replicable model, then we should implement it all over. And then even sometimes it looks a little different in the city. You look at some of the encampments that we find in our cities may not be exactly like what's happening in the river bottom. They have different dynamics, different elements there. And so it's important that we have effective protocols there too. Number 16. This is where we ended before we were buzzed back into the meeting. Support the decriminalization of homelessness. So there was some good conversation there. I think we know some of the county emphasis through behavioral health and COC, but also some of the folks in our group were saying, really increasing public awareness and advocacy and awareness campaigns. Social media, those of us who are a little older may not be as keen to social media. Some of us are, but there are ways now that people can be made aware that are really effective, that are different than our traditional means of like just posting a flyer or even having a website, but like TikTok and some of the other things that can really, really make people aware are important to utilize. And then community organizing, it's enough. We can say things or post things and all that, but there comes a time when we've got to engage. Appreciate a lot of the advocacy that we see coming out of COC. And I know Greg does a lot of engaging at the state, local, national level. And I think that's important that all of us, go to city council meetings, all of us go to supervisor meetings, things like that, that can help spread this positive message that everybody who's homeless is not committing a crime. I think that's where we ended. So we didn't get to 17 and 18. So did I capture everything, folks, who's in my group? All right. Thank you.
Rashawn, I believe you're on mute.
The story of my life. I'm always muted. Great job, Team 1B. With anyone who was in his group, does anyone have any other additional comments? If not, we will move forward for performance measure 2.
And Tanya, I don't know if you're able to share. I emailed you mine.
Sure.
For some reason, when I share, I can't see it on the screen, so I have it up separately.
All right.
And I'll just preface it with that I had described myself, so mine's not going to be as pretty as everyone else's. So.
Excuses. Kidding. I'm kidding. All love.
By the way, I personally do not see any of these things that you're posting to see. I just can hear everybody and I see everybody, but not whatever you're sharing on the screen.
Karen, you might want to check your setting, because is she the only one that's experiencing that? Is there anyone else experiencing what you're not able to see what's being shared on the screen? Carol, I need to say
yeah, Jenny, you might need to look at your view and change the view. Okay. All right, so we will go into our first one was strategy 3, the implementation prioritization framework. I just put a section on feedback so we could track all that. We didn't really get into a lot of new ideas. We had a really, really robust discussion on all the aspects. But primarily, it should be Michelle brought up a great point about, are we tracking what the root causes are And how can we do that within HMIS and then report out by district and jurisdiction? In order for us to address the root causes, we need to know what they are. And so that was a really great point that Michelle brought up. We really talked about analyzing what's existing and what's not existing, what are the barriers. I know we've done that a lot on our gaps analysis, but looking at the areas that are lacking resources and how we can develop the resources in those areas as well. Again, we all know about the challenges of NIMBYism. We know a lot of our cities acknowledge the problem and want assistance, but when we come with concrete solutions for siting, whether it's shelter, transitional housing, or permanent housing, we're met with quite a bit of resistance. It was brought up that, you know, there's a lot of new state legislation that does by right, but that still can be challenging. And then again, the challenge of just the availability of resources as well. We also had a pretty extensive conversation on prevention, which really is it within this strategy portion, and especially around senior homelessness. As we know, as individuals, especially as couples, as one individual may pass away, the burden of rent and the cost of living on the surviving spouse or partner. Additionally, too, is just the difficulties, and these are obviously very bullet pointed, but the difficulties around qualifying. We know that rents have gone up exponentially so in Riverside County over the last 2 to 3 years, and you know, are way above our fair market value rate for voucher systems, and just the unwillingness of landlords even to continue with the voucher system because of the high rents that they can get. Hopefully through some of our landlord incentive programs and stuff, we'll be able to do that. And then also the real big issue too, we talked a lot about is people, they deny services, both individual, whether it's behavioral health services, outreach services, linkages to other housing or sheltering, if it's not in the jurisdiction where they're at. They do not want to travel primarily outside of the area. We listed as the lead agencies, HWS and RUH Behavioral Health, just for the need for coordination with CES. And then also as co-leads, service providers. And when I talk about service providers, this is all our nonprofits, it's our cities, it's all the players that we talk about that I know a lot of you listed out specifically within your recap. And then a couple ideas we had as far as new ideas on this one, looking at rent control measures, maybe start with mobile home parks. We did include some of that in our housing element at the county. That is submitted to HCD. However, it did make the point this would be a big lift, rent control overall countywide, but maybe we start at a local basis with some of the more progressive cities that might be willing to do that, such as say Riverside or Palm Springs, for example. And then education and implementation of fair housing guidelines. There's a lot of good tools that we can use within that, and we actually utilize them down in another one as well. So Tanya, scroll down to strategy 5. And this was strengthen coordinated access. We had a really robust and long conversation on CES. You know, we mentioned that CES has gotten a lot better. A lot of that is because of the work of Marcus Cannon and now Monique on board, but also the integration within the HMIS system. But we also acknowledge there's still a lot of work to do. And Monique and her team have some great ideas and plans on how we move forward. We need to have a more developed CES website, possibly an AI chatbot that can be a little bit more interactive for our clients. A lot of them don't know what CES does or what it's about. And, you know, we all, I know on this call, especially those of us within departments, get the calls of, I want housing right now, and you got to get me house, I'm on the list. So, you know, how do we communicate that in a better way? We really talked a lot through all of this about the use of technology and how we can really use AI and app-based systems and web systems to really be more forward-facing and more proactive. Ongoing education, high turnover rate of employees within, we know, not only the county at CES management level, not management level, but lower line staff level, as well as we know service providers. And so that constant need for ongoing training, especially as we implement new types of systems within CES. How can we standardize assessments between the VI SPDAT, the implementation? I'm going to be over the head on a lot of people, but you'll learn about this a lot over the next few months, the whole person health score, as well as how are we doing an intake system that is more predictive and that looks at racial equality and gender equality and is, you know, again, a much more standardized assessment. Interactive trainings, again, for our case managers, utilizing motivational interview. A lot of that, again, can be done through some AI type work. And then better coordination amongst agencies. We've talked about this a little bit and how we can track through HMIS who is the current case manager versus the last case manager that's in there. Again, a lot of this is technological. I just will say the coordination I've seen amongst the COC members, the county agencies is far better than it was, but I think all of us will recognize we always can do improvement. And then our last one, strategy 11, and unfortunately we got to the tail end, but we wanted to make sure we address this for race equity and homelessness response. Again, we utilize fair housing as one of our key agencies, along with housing and workforce solutions. Again, thanks, Michelle. We wanted to analyze racial equity by districts and cities, because if we don't know what the deficits are, or if there's positives, Salam did chime in. Thank God, Salam, about that. The HMS team is analyzing that equity analysis for our HEP allocation. So we are doing to do that. But as we get that data, it's going to be interesting to see where we can actually focus some of our efforts. Again, integrate the fair housing. And Michelle brought up a great thing that the city of Riverside is doing, is tracking racial data in their housing units and that are on waiting list. Just knowing that some landlords or some developments have intentionally not been equitable in there. A couple of new ideas we thought about, again, just taking from the city of Riverside's action, is tracking housing placements and waiting lists, and then ongoing competency training as well. So those are our big highlights. If anyone on the team thought I missed anything, chime in.
Great. Thank you, Greg, and team 3. That was team 3, right? Systems performance measure 3 or 2?
We were 2.
Okay, sorry about that. We will move on to systems performance measure 3. Group 3.
Yes. Hi, everyone. Javier here. Gershom, can you upload the your notes, please? We had 12 strategies, but we were able to get through at least half of them. I know it's a lot, but like a lot of you, we had a very good discussion, a lot of passion in the work that we do when it comes to homelessness and housing and affordable housing specifically. So starting with strategy 21, advocating for the increase of production of affordable housing. Of course, lead agencies would be elected officials to promote affordable housing, or affordable housing developers, I should say. And some collaborating entities would be organizations like Valley Restart Shelter, DPSS, Operation Safe House, and perhaps others in this group. Some of the ideas we came up was fast tracking development for affordable housing at the city level and county levels, making tax credits available for affordable housing developers to increase inventory, partnering with cities to create a buy-in, especially with their housing elements that each city has. A lot of cities develop housing elements, vote on them, and then, they're collecting dust somewhere. So another one, changing the process of applying process for tenants, eliminating too many barriers to apply for affordable housing, restructuring the application process, adding a supportive housing component, and of course, some case management for single family developments, adding more resident services for multifamily developments and others. So that was strategy 1. For strategy 2, Gershom, if you can go to the next one. That's increasing permanent supportive housing units capacity. Some of the key players there would be DPSS, Housing Authority, elected officials who have advocate for more faith-based organization involvement. I know there's a lot of talk of churches playing a key role in developing some of their properties into affordable housing or some transitional housing and so on. And then nonprofits who expand their housing units. Some of the key ideas here is training more staff, organizational collaboration, and open communication. So organizations don't, keep reinventing the wheel, so to speak, and then suggesting less barriers to entry. For strategy 23, that's increasing rapid rehousing. Of course, again, key players are those organizations that currently offer rapid rehousing and perhaps opening it up to other nonprofits and so on. Partnering with landlords and offering landlord incentives. I know some of those are probably already listed there. And having landlords who work with individuals experiencing high barriers. Sometimes we refer someone who might have an eviction on their record, and that automatically, kicks them out, as opposed to really seeing what the reason was for the eviction. Could have been a loss of a job or loss of a loved one, the breadwinner, et cetera, et cetera. So, revisiting a lot of those restrictions that are currently in place and see how we can make them more flexible to have people rehoused through rapid rehousing. And of course, some of the bullets that are already listed there are very good. Strategy 24, developing a centralized landlord outreach, very similar to the previous one. Again, rapid rehousing providers, forming a coalition of those entities or nonprofits to share resources, bounce ideas off each other, and so on. Again, working with tenants that have past evictions, creating community events for outreach, getting to know the partners they'll be working with, and having more accountability and reporting. And so on. Again, a lot of the bullets that are already there, we were discussing also, so that's very good. Let's see. The next one is approaches to expanding existing housing stock. Strategy 25. Gershom, you can get that down out there. Yeah, key players, again, housing authority, affordable housing developers, and pretty much all of us, really. I mean, we're all advocates for that. And other supporting entities would be legal advocates, and Fair Housing Council, and so on. One of the members talked about master leasing, and of course it's already listed there, but that's a big one. Shared cost housing, and working with tiny home developers or container home developers, and just thinking outside the box, really, or getting rid of the box altogether, and just offering other suggestions for long-term permanent housing. And then I believe we ended up with strategy 26 to increasing flexible housing funds. Good discussion here. COC and HUD, obviously, funding source would be the leads there. Some of the concerns that were raised by the group were fronting a percentage of grants for nonprofits. As you all know, our grants are reimbursable grants. So the nonprofits, we have to spend money first and then submit for reimbursement. So a lot of organizations are not able really to do a lot of that initially. So changing the way funding is provided is very important. And then also opening it up and minimizing restrictions, a lot of restrictions. You guys all know, you get a HUD grant and, loaded with a lot of things that need to be taken care of course, first. So I think being more flexible in how organizations can use funding. Another one was funding for operations. It's very important to be able to hire staff and train staff and keep the staff you already have. Most grants are project focused. So we need more for operations, for staffing, and so on. So those are some of the concerns and some of the ideas our group came up with. And if I left anything out, please feel free to jump in. But that's where we ended. So thank you.
I just
Great.
wanted to acknowledge this group and all the other groups that have already gone and reported out. Just know that we are so impressed with the discussions that you've had, the ideas that you've shared with us. We're excited to continue working with you to see how we can implement these in the next couple of months and in the next years as we work through our current HAP rounds and, of course, this next round of HAP funding. I also want to acknowledge that we still have 65 participants in the room. So thank you for hanging on with us, listening in. Roshana, Mariela, and myself were at another community HAP workshop, another county, and I think they had 15 participants in the room. So to know that we have, basically times that number by 4, by 5 is just impressive. And again, just shows the commitment from all of you to really build out a strong homeless system of care. So I just want to thank you for hanging on with us. So excited to continue these discussions with you. Roshana, I'll hand it back to you.
No problem. Thank you, Tanya. And I just want to echo what Tanya said. Thank you guys for hanging in there with us during this process. All great information. So the next systems performance measure is systems performance measure 4, and that is the average length of time that people experienced homelessness while accessing services. So we're looking to reduce the time it takes for them from the time that they access services into moving into housing. So we want to shorten that time frame. And we had there were a number of key strategies, about 11. We had 11 key strategies, but we only got through maybe 4 or 5 of them. And we focused on action area 4, which in our homeless action plan is expand and ensure equitable access to permanent housing in our communities. So Tanya, you're sharing it? Okay, thank you, Tanya. So for the first strategy, we had advocate for increased production of affordable housing. And the lead entity we put as HWS are, as you are aware, we have a development department that is really, really amazing when it comes to development of permanent housing or affordable housing within our county. And then some of the collaborating entities or agencies, we have like mayors, city council members, business partners, chambers of commerce, developers, independent counsel for zoning. And we said independent counseling because we looked at the zoning plans, as well as churches. They are a big part of helping us increase the production of affordable housing for our county. We haven't discussed any new ideas, and if anyone in my group, if I am misspeaking, please speak up. We just went through the key actions that we already outlined in our homeless action plan for this one. The next strategy, and a lot of them may seem the same as you just heard from performance measure 3, because they are similar. Strategy 23 is increase permanent supportive housing units and capacity. Again, HWS, our development department, and some of the collaborating agencies or entities will be landlords, because we definitely need them. Without our landlords, we won't be able to house our program participants. Service providers, and I realized on some of your other presentations, you guys spelled out each service provider. We just put service providers. Behavioral health, our city public relations department, so that we can get the word out, educate our community about our services that we provide and the population, because I think it's a lot of people are uneducated about the population. Fair housing and is a big part of a collaborating entity for this development of permanent supportive housing units. Elected officials to help us get around the red tape. and then, of course, our housing authority. And then one of our new ideas was we want to work more with our city public relations department, as I stated earlier, is to educate the community about our services and the populations. And then another idea that came out of this is establish landlord incentives specifically for permanent supportive housing residents. Next strategy. Strategy 23. And I'm not going to go long into these because I realize Javier and his group covered a lot of them that we covered as well. But our lead agency, again, Housing and Workforce Solutions, collaborating agencies as service providers, RUHS, CES, and our managed care providers. I skipped TAP department because that was one of our new ideas that came out of our discussion, was collaborating more with our county TAP department to provide additional staff to fill in some of the gaps that our departments are lacking. Next strategy. Develop a centralized landlord outreach, engagement, and retention strategies. So you guys heard a little bit about it during the beginning of our presentation. Lead agency, Housing Workforce Solutions. Collaborating agencies will be service providers, all of you all as service providers, landlords, chambers of commerce, and managed care providers. And I think we stopped at that one, if I'm not mistaken. Yes, we didn't get to the rest of our strategies. If I missed anything, Linda, Dr. Larissa, Oscar had to leave. Please feel free to chime in. With that being said, that was performance measure number 4. Now we are moving on to performance measure 5.
Thank you, Roshana. I just wanted to quickly thank all of the members of my group that actively participated. We heard from everyone and got some really great discussion and dialogue going. We had a good representation of service providers. We had a few of our managed care plan staff members in there, as well as community member, and we will go ahead and get started. So our performance measure was the percent of people who returned to homelessness within 6 months of exiting the homeless response system to permanent housing. First strategy we looked at was increasing homelessness prevention, diversion, and mediation services. We identified the Hope to Home initiative, which is being led by the Continuum of Care with collaborating entities as the Coordinated Entry System, 211, Fair Housing Council, and also homeless service providers. Suggestions to continue to enhance the Hope to Home initiative and having landlords make referrals. One of our group members participated in that meeting and was very impressed by the work that is being done and suggested that we continue on the course as planned to help support this strategy. Also working closely with large rental companies. There is a trend that some of our service providers are seeing in that these larger rental companies have been increasing rental rates slowly. And so looking for more mom and pop type landlords, but also there was a suggestion to setting parameters with the rental companies for rental increases. So good discussion there. Moved on to the next strategy, expanding opportunities to achieve financial stability and economic mobility through employment, education, income supports, and wealth generation. Looking at Riverside County Workforce Development as a potential lead agency, as well as the Department of Rehabilitation Services. Community supports teams was also a suggestion that was brought up. We need to do a little bit more research on that. Probation department for those that are justice involved, working with Community Action Partnership, community colleges, and RCOE. Looking at provider examples like Valley Restart. One of our group members shared some of the work that they do in connecting their clients to employment opportunities and education programs. Someone mentioned potentially utilizing 211 as a resource to connect folks to some of these opportunities, and also bringing back high school ROP type programs to connect some of our youth to those opportunities before they even graduate from high school, so that when they graduate, they are ready to join the workforce in targeting those that are homeless or at risk of homelessness. Looking at our next strategy, reducing re-entries into the homeless response system. There was a lot more discussion under this strategy. Lead agency identified as HWS Continuum of Care, as well as a coordinated entry system and housing providers. What some of our providers shared is that oftentimes they'll see clients that are put in programs and they're just not the right fit for them. And so this can cause some re-entries back into homelessness. They notice that they need a higher level of care once they're already in the program. And it wasn't really determined until they've already been enrolled for some time. Also, there are a lot of them that are accruing arrears. And one of our providers shared that in San Diego County, there's a program that focuses on retention. And they really look at clients that are at high risk of re-entry, that are exhibiting some behaviors such as, not engaging in services, or they're collecting arrears in rent. And so really looking at intervention with those clients, connecting them back into services and continuing to work with them. And they have a fund set aside to help pay for those arrears. So there was a recommendation to develop perhaps a program or a strategy similar to that within our county to help support those individuals. Our managed care plans also shared that there is a community supports that is housing tenancy sustaining services with the goal of maintaining clients in their units. And we did need to have additional research on this because there was limited information on what that program actually provided. So we made a note there to do additional research and contact an individual who is over that program. And then there was also some feedback about clients that are participating in certain programs, current existing programs at some of our emergency shelters that help them to set aside funds to develop a reserve for them to utilize towards rent and housing deposits. And I believe we had one more strategy there. Was expand protections for renters and tenants, identified the Fair Housing Council as a potential lead agency, as well as the California Board of Realtors and local municipalities. There was some discussion about what cities can do to pass municipal codes or at the county level ordinances in the unincorporated areas and how that might help to expand protections. But also from a more practical perspective, some of our housing providers said just it would help them to keep up to date on laws and tenancy rights, and also to have resources available to them that can help whenever they have clients that are facing issues with landlords. Some of them just really don't know where to go. So that was as much as we got to. So again, I have the list of my group members there, and I just would like to thank all of them for their feedback. And I believe we have one more group number 6.
Hello. So we had a light discussion, I'll call it. We spent more time later on some of the strategies, but in the strategy 12 of increasing the regional capacity of homeless street outreaches, we're aware of some collaborating entities such as Operation Safe House, CityNet, Walden Services, and then a few others that were out there. Didn't generate too much of the new ideas. One thing that we did leave off, I would say, is some of our secondary and post-secondary, because again, our high schools and our colleges are required to help come up with some of the solutions as well as track these young people that are experiencing these problems. So there's someone that we can lean into at how they go about reaching out to those that are experiencing these problems now. In our strategy 17, the next one, developing training for our first responders, we looked at reaching out to, again, some of the agencies that are providing those services. On the collaborating part is like our local fire departments, police departments, even AMR services. I know that a few of them have partnered with RUHS, behavioral health, mental health, and they actually have a core team that will travel with law enforcement as well as CAL FIRE or the local fire departments at providing those services to those in need. Because a lot of times, someone had mentioned it earlier that it's not a crime to be homeless, but sometimes that's how they feel, that criminal aspect of it. So having the first responders, more informed about who they're working with or who they're about to encounter. And I know they've been immersed into it for the last several years. So I think on that line, we talked about being able to help support that even deeper. Moving on to the strategy 22, increasing permanent supportive housing units and capacity. Again, not a lot on the solution part of it or the new ideas. It was shared with the group. Illumination Foundation and High Expectation Development Corporation were two of the partnering agencies that may be able to assist us with that, at identifying and asking those questions to, help come up with some more solutions, especially on the supportive housing. I believe we also discussed a little bit about more with the COC at their efforts at coming up with those units, places for them to be at. Nikki shared a little bit about with what's happening at High Expectations, as well as on the Illumination Foundation with Akia. I'm going to pronounce her name wrong. I did during the whole breakout session. We move on to the next category there. I believe it's 26 or no, I'm sorry. Yeah, 26. The increased flexible housing, housing funds. She also shared with us some of those partnering agencies, the Cal AIM, as well as CAP and Catholic Charities and Salvation Army, those that are already providing those type of services so that they can get that supportive housing. And I believe our last one is the one we spent quite a bit of time talking about, is developing strategies to reduce barriers in obtaining housing and increase the speed up of lease processes. We didn't identify anybody in particularly out there, but it was shared about some of the housing programs. And you look over here on the ideas part of it, a home sharing program specifically with our seniors that are out there at providing home assistance, where you might have multiple people living under the same household, as well as getting in the benefits checkup. It's the nation's most comprehensive and free online tool to connect all adults and people with disabilities to those benefits. She had shared with us that it's based in Vermont, but it's a national program. Some of the other ideas on there were there we go, the financial skills banking. And again, a lot of the homeless people that we encounter were exposed to the situation that they're in now due to the lack of understanding their financial commitments. So again, some of the training that could be provided through that agency as well. And then again, promoting the work opportunities for older adults. Many of them are still able to work 10, 20 hours a week, as she shared with us. So finding those employers out there and assisting them on that pathway. And then also about the advocacy and navigation services, like the county has an ombudsman, I'm going to say that word wrong.
Ombudsman.
There you go. They have a fantastic program, and I know at least with Supervisor Gutierrez in the 5th District and Supervisor Washington in the 3rd District, I've been exposed to both of those and their programs that they have at helping be advocates and really, I'm going to say caregivers on the flip side for some of those in our senior community. So, and then again, being able to provide support for those that are experiencing homelessness. Many of them have the criminal element background to them, especially on the younger ones, as well as those that are coming out of the juvenile justice system and or on the adult side, probation and parole. It's always a barrier for them at either one, getting those things expunged. We talked a little bit about one of the local agencies, Spark, who I know has been involved with us on these calls for quite some time, Teresa in specific, at helping those young people get through that, because on the legal side, it's very hard for them to get things moved forward, especially when it comes to rent and leases. So again, we probably spent more time on this topic here than the others, but that was about it for our group. Thank you. And thank you all the members that were on that call with us.
Great work, Greg. Great work to your team. Is there anybody else from the last system performance measure that would like to add comments? I'll give it a second. Okay, well, once again, we just wanted to provide some closing thoughts before wrapping up. Definitely want to highlight the fact that we're still at 60 plus members, and it's after 4 o'clock. It does look like we're going to be getting you out of here a few minutes earlier. But I did just, again, want to take time to acknowledge that we really love that it was very natural for you guys to have these discussions, which really focus on looking at the barriers, the challenges, as well as the opportunities that exist at a systems level. I remember when I started with the Continuum of Care about 10 years ago, and agencies, projects really felt like they were, trying to solve homelessness for the person in front of them themselves. And I think it really speaks volumes. It speaks not only to your commitment, but definitely to your expertise, your knowledge, in understanding that we're stronger together. And oftentimes, the very things that lead to our success are being able to connect that person in front of us or in front of your team member who is at the river bottom that your street outreach team is connecting with. That there are often influencers that are beyond our local control or that your team members' immediate control, and really require us coming together to look at how do we, engage in a larger centralized landlord locator program, which we're doing through the Hope to Home Collaborative. How do we really look at building partnerships with cities so that we can develop new projects, whether it's shelter or permanent supportive housing in regions where concentrations for homelessness is the highest. I love hearing that we're looking at how do we integrate AI as a tool to help us expand access and respond back to people more immediately, so they're not waiting for someone to come in at 8 a.m. to find out where the nearest resource is. And again, these are not ideas that we thought about alone in a vacuum. These are ideas that came out of this HAP Round 5 session that all of you have been involved in. So thank you for reminding us that we're stronger together and that it's when we work together that we can really change our system, that we can really influence local leaders, city, county leaders, as well as state and federal leaders to really support the work that we're doing. So as a reminder, we will be taking the feedback that was shared today and incorporating that feedback into our HAP 5 application that is going to be due to the state in 4 weeks on March 27th. Our plan is to hear back from the state by June of this year. So as soon as we hear back from the state, know that we will report back out to you. I should share that the funding has already been allocated to Riverside County. And so we anticipate that by the time we submit the application and even before June, when we anticipate hearing official news of our award, that there's going to be a lot of communications between our team and the state on our local efforts. So if there's any new information that comes out between then, just know that we will be in touch with you. Additionally, we will definitely take our Continuum of Care chair up on our offer and make sure to send all the different notes that were taken in each work group to all the facilitators in case or in the event that you have additional feedback that you want to elaborate on. Additionally, if you are here and you have additional input that you want to share, I know sometimes we'll end an event, I'll leave a work group session and then I'll go home and the next day I'm like, oh man, I should have shared that. Feel free to reach out to us. Send us an email. You can contact me directly. You can send us an email at coc@rivco.org. Reach out to us. Again, the application is not due until March 27th, and we really want to make sure that your voice is heard. This is a community-wide application, and as was mentioned earlier, it's really a regional approach that looks at the Continuum of Care's allocation and allocation the county receives. And then, of course, the city of Riverside, Michelle Davis, director of the city's housing and homelessness program is here. And I know she also shares in those sentiments. So before closing, Michelle, I did want to hand it off to you and see if you wanted to share any closing remarks.
No, I just want to thank Tanya, you and your team for putting this great workshop together. I know it wasn't an easy feat, so we really appreciate you and your team. The City of Riverside looks forward to working with all our partners. We're not in this alone. We have a lot of great partners here in the City of Riverside and our adjacent cities that we're working closely with together. So we will be moving forward with the HAP 5 funding plan at our committee on Monday, and then following council on March 19th. We'll be doing a public hearing as well. So we'll make sure that the COC gets that information as well, because we want our providers there and folks from the community showing their support for those resources that are needed for our community.
Thank you, Michelle.
Guys.
And I believe our COC chair, Karen Roper, is still on the line. We always love hearing from you. Karen, any closing remarks from you?
Well, I just wanted to compliment the staff. I think that you guys were really super smart to take the time to go to another county and observe their process, because you were able to glean things that worked really well and things that would help to really grease the skids and make this more of an effective process. And when you do that, it helps to keep people engaged. And here's proof in the pudding. You have all of your members from across the Continuum of Care that have been actively involved. But you guys did so much work behind the scenes to draft that document and get it ready for us to guide us. So I think we'll look forward to working with you for finishing touches to draft a composite that can go back out to the whole Continuum of Care for one last look, let everybody see if there's any other ideas that they may have thought of, and then, finish it, put a bow on it and ship it off, and let's get those resources into this region.
Love it. Bows are definitely trending. I have seen that, and I'm of course half joking. I also, in closing, wanted to thank our facilitators. I know, and we are so grateful that you always thank staff, and I definitely want to acknowledge Marielle, Gershom, Rashana, Emma, Damaris, and a bunch of other people on our team who have helped us put this event together, but also our facilitators who were brave and met with us an hour before this session to hear from us, obtain instructions, and did such a great job reporting out. So Greg, thank you. Leonard, Javier, Karen, we certainly appreciate you being brave and always just up for the challenge and helping us lead those community sessions. We are so thankful. So with that, let's make sure and let's see if you guys are still awake. Let's give each other a round of applause. If you can use the, mine says react, use the clapping emoji, I will say, and let's give each other a round of applause for hanging on and working through this effort together. You guys are truly the best community. Riverside County, so proud of the work that we're doing. And again, I never want to undermine that there's more work ahead of us to do. There certainly is. There's more people that we need to reach, but at least our focus is where it needs to be. And we so appreciate you guys taking the time to unmute yourselves and be a part of the conversation today. So once again, thank you. We will sign off and see you in the next few weeks for our next Continuum of Care meeting. Blessings to all. Thank you.
Bye, everybody.
Thank you. Bye.
Thank you. Keep up the good work, you guys.
Thank you so much. Bye. Y'all have a good afternoon and a night.
You too.
Thank you, everybody.
You too, hun. Bye.
Bye, everyone.
Okay, family, take it easy. I'll talk to y'all next time.
Bye. Thank
Family,
you.
it is. Thank you.